So you're feeling tired, and you don't know why. And one of the common causes for that is something called sleep apnea. So sleep apnea is, by definition, you stop breathing when you sleep. Without taking a deep breath, without preparing, try not breathing for 10 full seconds. And then try not breathing for 20 full seconds. And you can feel your reflexes to start taking in your next deep breath. It's not comfortable. It's not going to be comfortable. Now, if you're asleep and you're not awake, your body senses this desire to breathe when the carbon dioxide levels in your blood rise to a certain threshold. And then your body freaks out, wakes you up a little bit, not enough to be conscious, and you start gasping for air. And so you spend the entire night holding your breath and then gasping, and holding your breath and then gasping. For most people, it's going to be something called obstructive sleep apnea, and what obstructive means is just a blocked airway. And it involves your airway from about your jaw down into your chest. We call that your trachea. And you have a lot of things that live in your neck. It's from your tonsils all the way down to your voice box. There's a lot of things there. And any one of them can cause your airway to kind of close on itself. You probably know you have some variant of sleep apnea because you snore at night, or your partner told you you snore at night. You've been told your whole life that it's hard to sleep next to you because all this tissue, it's, for whatever reason, is kind of collapsing on itself. And when you're trying to move air in and out, that air is now fighting against a very small tube, and that vibration that's caused is what we call snoring. And for most people, the treatment for sleep apnea varies. Sometimes it's surgery, but more likely it's something called positive pressure. So we basically, you wear a mask at night and it pushes air down. And that makes everything kind of open. So despite the pressure, you have this air that's being forced in, and it kind of stents everything open. So your airway is kind of like forced open by this mask. And that way you can just keep breathing in and out all night and actually sleep. Now, if you don't know, if you are just feeling tired and you're not sure what's driving it, you can download the K app, put in your symptoms, and you'll learn how other people were diagnosed, whether this is most likely sleep apnea or not. And you can always press a button, talk to a doctor, and get some more information.